Okay, sorry about that. We had some technical difficulties, so I apologize for getting started late. This is being recorded, so you can hopefully watch it later, those of you who would like to. I'm talking today about the trifecta. There's been a lot of discussion around the upper respiratory infections that are circulating at this time, and trifecta. There are 3 in particular, but there are many more than 3 viruses that are circulating. COVID, of course, which has been with us for too long. Influenza, which is a little early for our season of influenza, and then RSV, respiratory syncytial virus, and the impacts that other respiratory viruses such as adenovirus and norovirus and the other viruses that normally circulate that cause common colds, because we haven't seen them for a couple of years during COVID with our aggressive hand washing and face masking and social distancing. We haven't experienced these illnesses, and we're seeing more significant illness because our immunity that we normally carry over from year to year, we have memory immunity, and our immunity, for a reminder, is the system in our body that fights infection, and our immunity generally is carried over from year to year. But being that we haven't seen these infections for a number of years, we're seeing more severe infections from them. In RSV, for example, normally would cause a common cold in most adults, but is leading to ER visits and some hospitalizations. Those are primarily occurring in kids, but I just want to go over a little bit of information so that you're aware of what this is and what this means. As a general reminder, viral infections are caused by viruses, and viruses cannot live or replicate on their own. They require our DNA to function, so they gain access to our cells, multiply within the cell, and replicate until our cells can't withhold that pressure from the viral numbers. And when the cell membrane strength is overcome, the cell ruptures, and these millions and millions of viral particles are released into our bodies, and that's what causes our bodies to mount an immune response with the myriad of symptoms that we get with coughing and sneezing and headaches and nasal congestion, sore throat, body aches, fevers, chills, sweats. All of those symptoms happen as our bodies are trying to fight off that infection, but those viruses multiply inside our cells until their sheer numbers overcome the strength of our cell membranes, and then they're released and then find other cells to hide within. That release of those viral particles allows our bodies to see the virus and start mounting an immune response, which is all of the symptoms that we're experiencing. One of the concerns with the viruses that we're seeing now are that, as I said, we haven't seen them for a couple of years, so our bodies don't have as robust memory immunity to fight the infections as well as we normally would. So normally we would get a cold, maybe some sniffles, runny nose, mild cough. We're getting really, really sick from them because we haven't seen them for a while. And we're also getting co-infections or infections with multiple viruses that is taxing on our immune systems. So I'm going to go over some information about COVID in our region so that you're aware. In the treatment for viruses, antibiotics circulate in our bloodstream. Viruses multiply inside our cells, so they aren't in the same compartment, if you will. And so antibiotics don't help viral infections unless you've had the viral infection long enough that the bacteria also take advantage, and you have a superimposed, so an infection, a bacterial infection on top of a viral infection that might cause sinus infection, an ear infection, a pneumonia, bronchitis. Those types of bacterial infections can happen as your body is fatiguing or getting tired of fighting the viral infections. But as a general reminder, viral infections are supportive treatment with hydration and rest as you allow your body to fight those infections. And when our breathing tubes are infected, you can use something like cows that is a natural bronchodilator, mountain tea. Those things can also be helpful just to kind of maintain hydration and help with symptom management. So let me talk a little bit about COVID. So this is information from the Portland area office. There has been a slight uptick in cases over the last week, as well as hospitalizations and deaths, unfortunately. The community risk levels are what dictate kind of what status we are in our communities, and I'll show you our 5-county region in just a second. But let me share with you the COVID cases. Where's full screen? Is this full screen? I don't want those. I don't want that. I apologize. Let me change. Can I change screens? Oh, it's backwards. Hang on. Will that allow me to change the screen? No. Okay. Well, I will work with what I can. I apologize.
Yeah, we didn't change this.
I need to get the presentation on the other side. Okay. I apologize for the size of this. It's not showing the screen. It's showing me. Oh, this is delayed. Okay, I apologize. So this is a graphic of the daily new cases. This is for the state of Idaho. On 12/5, there were, in the past 7 days, there were an average of 4 new cases a day. And please understand that some of these cases aren't, the data isn't collected because of home tests. These are, which it's good that people are testing and identifying if they have COVID to take precautionary measures. But as you can see, the decline of COVID is significant. So this is a regional COVID-19 review, and just as a reminder, when we're determining COVID-19 community levels, we are looking at new cases per 100,000 population in the last 7 days. So if there are less than 200 cases, this is the measurement. This top section is what is used. If we have more than 200 cases, then this bottom measurements are what we're using. The COVID-19 community level is determined by the higher of the new admissions and impact and inpatient bed metrics, or on current level of new cases per 100,000 in the past 7 days. So this says new COVID admissions per 100,000 in the past 7 days, or the percent staff inpatient beds in use by COVID in the past 7 days. So low is less than 10 per 100,000 in the past 7 days, and less than 10% of staffed inpatient beds. So inpatient beds are those in the hospital. those that are in the hospital. And then medium is 10 to 20%. I'm sorry, 10 to 19.9 new COVID admissions per 100,000 in a 7-day total. And then staffing is 10 to 14%. And then high is above 20% and greater than or equal to 15%. So that's just a reminder of how the determination of community levels are measured. So in the surrounding counties, Nez Perce County is in a medium level. As you can see here, the new COVID admissions per 100,000 population is at 14.8. So between that 10.9 and 19.9 range, and the percent staffed inpatient beds used by patients with confirmed COVID is 7.3, which is actually a green level, but we take the worst of those two measurements, and that gives us a yellow medium community level. Clearwater County has a medium level as well, again 14.8 and 7.3, but their case rate per 100,000 is at 68.52. That's just a general measurement. So they're also in the green level. Idaho County is in a medium level. Their case rate per 100,000 is at 84. Their new COVID admissions per 100,000 population is at 14.8, and their percent staffed inpatient beds in use by patients with confirmed COVID is at 7.3. So again, in the medium range. Latah County is in the low range. They have 1.1 new COVID admissions per 100,000 population, and their percent staffed inpatient beds with confirmed COVID is at 1.2%. And then Lewis County is at high level. They have their case rate per population is at 338, and puts them in that lower category for greater than 200 cases. And so their new COVID admission rate per 100,000 7-day total to be in the medium range needs to be less than 10. And because theirs is at 14.8, they're in the high range. But their percent staffed inpatient beds used by patients with confirmed COVID is at 7.3. So this measurement of case rate per 100 population and their new COVID-19 admissions per 100,000 population is what places them at in the high level range. The variants really haven't changed much. We're primarily seeing BQ11 and BQ1. And BA5 is tracking down at about 15%, and BF7 is down about 7%. Let's move on to the flu. So this is a national depiction of the influenza and or influenza-like illness. So not everybody is testing for the flu, but if you have symptoms that are consistent with the flu, it's counted as influenza-like. That's what ILI means. And purple is the highest level that you can have. Maroon, and then the colors decrease, as you can see here. So very high are the top three colors depicted. High is dark red down to light orange. Moderate are these orange to yellow variations, etc. So as you can see here, so there are 44 states that are in the high to very high level in our country. Not much has changed from last week. Alaska, Michigan, and West Virginia are very low, and nobody really knows why. But the Northwest has virtually been unchanged. As you can see, Washington is purple for very high. Idaho is also very high. Oregon is also in that very high range. The strains that are primarily circulating are H3N2, and that's circulating approximately 75 to 80% of the infections. H1N1 is next at 20 to 25%. There's hardly any influenza B, which unfortunately we're expecting to circulate a little bit later. There are several subtype A or influenza A's that haven't been typed yet, and that information or data will be passed on when it's available. So this is a graph of percent visits. So the percentage of outpatient visits for respiratory illnesses reported by the U.S. Outpatient Influenza-like Illness Surveillance Network. And this is a summary of 2022, 2023, and then this is comparing it to prior seasons. This is the current season, this triangle, dark brown graph line, and as you can see, so this dotted line here is the epidemic level. When we started the flu season at week 40 of the year, we started above the epidemic level, and you can see that it's been slowly increasing over the past 6 weeks or so, and is now trending down. We're hopeful that this is coming down, but only time will tell. And you can see that the other preceding years, 17, 18 is light blue, 19, 20 is green, 2021 is pink, and this is when we had, COVID and everybody was isolating and staying at home. And then the 21, 22, we did have a slight peak of COVID, this orange line, but then again was very quiescent because of the measures that we were taking. But this just kind of gives a comparison for the past couple of years. The flu vaccine that we have actually has great coverage against the H3N2 as well as the H1N1, so it's effective. So that's a good thing. And then here is the influenza tracking for the state of Idaho. This is our current week summary. So the percentage of outpatient visits for influenza-like illness was at 7%. ED visits at 7%. Thankfully, we haven't, well, this is not accurate, I'm sorry, and pass on condolences to family members who have lost loved ones this season. And the predominant type is that H3N2, as I mentioned. Very highly active influenza activity in the southern part of the state, and then lightens up as shown in this slide. The last of the trifecta is the RSV, respiratory syncytial virus, and this primarily is concerning for children younger than 4, but for the third consecutive week, hospitalizations have decreased with RSV, but there have been reports of pediatric patients taking adult ICU beds because the pediatric units are overflowed with kiddos who have RSV and need respiratory support. So we may be over the peak and be heading in the right direction, which we're all hopeful for. Those age 0 to 4 are the primary age group that are getting hospitalized, unfortunately. American Indian Alaska Natives have the highest, most severe outcomes for RSV. Hydration is really important in assessing respiratory assessment, seeing how people are breathing and not waiting to seek care with any concerns. In kids, you often see what's called accessory breathing, or nasal flaring, where their nose will start to flare, their nostrils will expand and contract with their breathing, or you'll start seeing some indentations above their clavicles or their collarbones, or start seeing the skin go in within their ribs. Normally that use of those muscles we don't have to use when we're breathing normally, but when we have what's called increased work of breathing, those are signs or symptoms that kiddo might be needing some support. And pediatric patients in general can go along for a while and then just precipitously drop in clinical conditions. So it's really important that you seek care if you see any of those signs in your child to have them be assessed. This is a slide from the Idaho Health Association. They're high volumes. This is percent of specimens testing positive for RSV at labs in Idaho during the respiratory system. These are percent positives, and these are the weeks. So the RSV season started a little bit early, as depicted here, and then peaked precipitously, and thankfully or hopefully is coming down as I mentioned. And the last thing that I'm going to discuss is the CDC has come out with recommendations for COVID vaccines. There are some requirements that patients have to have to get them. The COVID, the monovalent vaccine, and these are from the CDC website. The monovalent is the original vaccine, and having that original vaccine is a requirement to get the bivalent. The bivalent is the vaccination that has both the original COVID virus strain and the Omicron viral strain. So this is available for your information. All right. Kira, do you have any questions for me to answer? Okay. All right. Well, I just appreciate you taking time, and I hope this helps provide some clarification about where we are and what we need to do. I'm thankful to be here to help, and we can answer any questions that you may have. But Chatsiayo and Tatsalach.